question here. A mother who had a cesarean delivery 5 hours ago. Suddenly, she appears to develop anxiety and complain of shortness of breath. So the key point is here, cesarean delivery and suddenly anxiety developed and shortness of breath. The nurse should assess the most priorities problem. So there are 4 options. Which one is the most important or most first to do? Here I'm going to read from 4, 3, 2, 1. Incisional discomfort. So if the cesarean delivery, C-section, incision discomfort is very common the first 48 hours. This is the minor surgical operation and mother undergo to the process labor. It is also common elevated temperature and elevated white blood cell. This is the normal findings after the delivery. And these two, temperature rise or white blood cell up, will be normal after 24 to 48 hours, right? But after the delivery, definitely mother have to be take rest. During this time, chance to develop some complication. So calf warm, calf muscle temperature raise, redness. This indicate patient develop the deep vein thrombosis. So deep vein thrombosis, shortly called DVT, or cesarean section, some tissue cut, even patient chance to develop fat embolism. So this deep vein thrombosis, if you do not take care of it, it can lead to complication. What complication? Like pulmonary embolism, stroke. So when in the clinical case like this, after any surgery, if we see this type of problem in the calf muscle, we have to take care first. What is their explanation? Redness, tenderness, increased temperature in the calf area should reported healthcare provider. Yes, this finding may indicate the deep vein thrombosis. Pregnancy is a hypercoagulable state that provide protection from hemorrhage during the childbirth, but increase the risk of thrombus formation, right? And thrombus basically lead to pulmonary embolism. This is the major issue, basically. So, anxiety and shortness of breath are the sign of pulmonary embolism and also result of deep vein thrombosis, right? So, NCLEX board like to the question, what are the sign of pulmonary embolism? The common sign of pulmonary embolism already mentioned in this question, shortness of breath, right? And also the anxiety. What are the other signs? Sometimes patient complain the chest pain, or you can get some added sound over the lungs, like wheezing or explain the shortness of breath, cough, and also coughing with blood, or sometimes loss of consciousness, very late stage. So let me read what are the educational objectives. Elevated WBC and temperature are expected findings during the first 24 hours after delivery. It is important to ambulate the client soon after birth. So when patient is ambulate, it reduces the chance of deep vein thrombosis. Otherwise, the client is higher risk of develop the complication like deep vein thrombosis. The question here, a nulliparous mother or the pregnant women asks about being in the real labor or true labor. The nurse should teach that which signs are most indicate of the true labor. So every student must know what is true labor and what is false labor, right? Usually the true labor, every labor pain has a contraction, frequency, duration, and pain have a nature and also some anatomical structure related with it. So first one, contraction that increase in frequency. True labor begins in the back and consistency of contraction increase with time. But the false labor usually start from abdomen or from the groin, and contraction is inconsistent, means they does not increase in frequency. Contraction that lessen after the rest. Contraction will decrease with time. No, it is not a nature of the true labor. Increase the blood or mucus with vaginal discharge. Nothing related to this. We are talking about the nature of the labor. We are not talking the discharge. Even this time, the discharge is not mixed with blood. Pain in the lower back. I said the true labor pain begin from the back, but the false labor start from abdomen or from the groin. So it is the another character of the true labor that move to the lower abdomen. And progressive cervical effacement and dilatation, another best character of true labor. The cervix dilate and effacement progressively increase, but it is insignificant in false labor. Now we are going to see a table where it is very clearly distinguished between true labor and false labor, what every student must know. The true labor about the contraction. So I said consistent pattern means it is regular interval, frequency regular, as a duration is particular and intensity increase over time. But false labor is irregular. irregular interval, no increase the frequency, duration, or intensity, may disappear even over the time. So it is inconsistent. The discomfortness begins the lower back, or I said the pain starts from the lower back, then radiate abdomen. What about the false labor? They started from abdomen or the groin. Comfort measure. What it is? Contraction increase, right? Increase with time or increase progressively. So you say walking position change and hydration the management, but comfort measure or pain increase progressively. But whatever the false labor, the comfort measure or pain is inconsistent. Contraction may less, right, or decrease with the time. What about the cervical change? The cervix dilate and effacement. So they said increase the cervical dilatation and effacement because baby is ready to deliver. Whatever the false labor, insignificant the change, no cervical change occur. So let me read the next discussion here. The key indicator of the true labor is progressive effacement and dilation of the cervix. So it indicates the system or labor is going to forwarding process. Contraction in the true labor are regular, increase the frequency, increase the duration and intensity. The pain may increase initially start in the low back and radiate abdomen. This is the other character of true labor, what we discussed few minutes ago. True labor contraction will not, you see, will not decrease the intensity or it does not decrease the comfort with time. May intensify with walking or activity. Braxton Hicks contraction. This is the sign of pregnancy, right? So in this Braxton Hicks contraction should be irregular, painless contraction throughout the pregnancy in case of true labor. So what they wrote, it is irregular and throughout the pregnancy. They do not result in cervical change in case of false labor. Although usually mild, they can increasingly painful and regular for short period during the last week before birth. However, compare and contrast with true labor, Braxton Hicks contraction will typically less with comfort measure, decrease the size or number or frequency. What are the educational objectives? Same information we are going to short review, right? During the true labor, the contraction increase the frequency, duration, and intensify over the time and result in progressive dilation and effacement of the cervix. right? It is very important. We have to know. The client in true labor often experience the discomfort in lower back that radiate to abdomen with contraction. And contraction associated with the true labor do not get less the frequency with comfort measure. A client visit the prenatal clinic for first time. Prenatal, right? Clinic for the first time. Here, this is a keyword. Which of the following are presumptive sign of pregnancy? Means very early sign. What are the reported by the patient that the client may report during intake of assessment by the nurse? Select all category. So out of these 5 options, which one is presumptive sign? So in this question, we're going to discuss 3 types of pregnancy sign. One is called presumptive sign, what is reported by the patient. Second one is subjective sign, and last one is positive sign. Let me focus first. What are the presumptive sign? So breast fullness and tenderness. The breast tissue change occur. This is the one of the presumptive sign. The breast tissue change occur because of progesterone secretion during the pregnancy and result in increase the breast size, tenderness, and darkening the areola around the nipple. Second one, just last menstruation period 8 weeks ago. So it means amenorrhea. So stoppage of menstruation is the first presumptive sign of pregnancy. Amenorrhea occur because increase the level of HCG, means human choriogonadotropin hormone increase. Another nausea and vomiting that are often every day. So nausea and vomiting at the first trimester of pregnancy, another sign. But it does not mean mother is must going to become pregnant, because we need probable sign, we need positive sign, should be positive. Painless contraction at irregular interval, it is the one of the sign of false labor. It does not relate to here. Positive home pregnancy test, it does not mean any logical clue. So positive home pregnancy, it is not a sign of early pregnancy. So in this table, we can get some wonderful explanation, right? They categorized subjective, objective, and positive sign of pregnancy. The subjective sign we called presumptive sign. Means what are the reported by the pregnant women. So cannot be used to diagnostic tools for pregnancy, but it is important. One is amenorrhea. Amenorrhea because increase the level of HCG, major cause. Patient complain nausea and vomiting. Then urinary frequency. Urinary frequency occur because enlarging the uterus and they put the extra pressure on bladder. Also, breast tissue tenderness. So breast change occur, not only the tenderness, increase the size and darkening the areola, and also quickening. Quickening mean the faint abdominal flattening and flat by the mother at 18 to 20 weeks, and also excessive fatigueness. Mother also complain the fatigue. What next? Objective sign, right? We call probable sign. So objective sign determined during the physical examination and result of vascular congestion in the pelvis. What the sign are? Like uterine and cervical change occur. There are some signs like Goodwill sign. Goodwill sign means the softening of the cervix and vagina. And also we can see the Chadwick sign. Chadwick sign means the blue discoloration or purple discolor of the cervix, vagina, and vulva. Another sign is called Hager sign. Hager sign means softening of the lower uterine segment. And Hager sign occur in the second and third month of pregnancy. Then uterine enlargement, right? Or some books said abdominal enlargement. More rapid after the 12 weeks when uterus raised into abdominal cavity. Another word is called Braxton Hicks contraction. It is the irregular, painless contraction throughout the pregnancy. What next? Ballotment. Ballotment means rebounding of fetus again, examiner fingers on pulpit. So when the gynecologist or obstetrician palpate the abdomen, they can feel it. It is called rebounding of fetus again the examiner finger. Next, fetal outline pulpit or uterine shuffling. What else? The skin pigmentation. What occur? Chalisma in the face, linea nigra in the abdomen, and also areola become darker, right? So positive pregnancy test or strigravidarum. So positive pregnancy test is most important. We measure the HCG level. We said we measure the HCG level. It is called so this one positive pregnancy test. What next? Now we are going positive sign or diagnostic test to absolutely indicate or indicator of pregnancy, like fetal heartbeat. or fetal heart sound heard by Doppler device. So in NCLEX board asks a question, when we can hear the fetal heartbeat or heart rate, or can auscultate the sound. So maybe we can hear at 10 to 12 weeks by Doppler, or maybe hear through the regular fetoscope by 18 to 20 weeks. And normal heart rate is 120 to 160 beat per minute. Then fetal movement. And fetal movement palpated by healthcare provider or visible the fetal movement. So it is very important, fetal movement felt by the second trimester. And last one, visualization of fetus by ultrasound. So ultrasound of fetus is the positive sign of pregnancy. At the 6 to 8 weeks, the fetal identification positive, an earliest positive method of diagnosis of pregnancy. So let me go next. And what is their explanation? I want to read it with you. So up to here, we said the subjective sign or presumptive sign of pregnancy are those that are self-reported by the pregnant client. This sign may have pathological medical cause and therefore can be considered diagnostic for pregnancy. Subjective sign, like breast fullness and tenderness, may occur just prior to menstrual period or with use of birth control hormone. Amenorrhea may have been with early menopause or endocrine dysfunction or acute or chronic disease. So it is not a positive sign. It is not a probable sign. Nausea and vomiting that begin around the 6th week after the last menstrual period may be result many other condition. So it is not a probable sign, not a positive sign, but the presumptive sign. What are the objective sign or probable sign of pregnancy? Are those that can observe by the healthcare provider during physical examination. Combined with subjective sign, this may be more indicate of pregnancy, but may still have some pathology cause. So it is not 100% sure mother get pregnant. So now go for the positive sign of pregnancy represent conclusive proof of pregnancy, means absolute indicator of pregnancy. So cannot be confused with any pathological cause, and they are all related to fetus. And what is the positive sign of pregnancy? One is fetal heartbeat. We can hear by Doppler, fetal movement we can palpate, and visualization of fetus by ultrasound.